Professional English in Use Medicine. Chapter 18, the endocrine system. A, excess and deficiency. An excess too much or a deficiency too little of circulating hormones causes a wide range of medical conditions. For example, hyperthyroidism and hypothyroidism, where there is an excess of hormone. One form of treatment consists of giving the patient something which inhibits the production of that hormone, as in the use of carbimazole to treat hyperthyroidism. When a hormone is deficient, treatment may be by replacement therapy. For example, injections of insulin in the treatment of type 1 diabetes. Doctors say sufferers of type 1 diabetes are deficient in insulin. B. Negative feedback system. TRH, thyrotropin releasing hormone, is secreted in the hypothalamus and triggers the production of TSH, thyroid stimulating hormone in the pituitary. TSH stimulates the TSH receptor in the thyroid to increase synthesis of both. T4, thyroxine, and T3, triiodoricine, triiodothyronine, and also to release a stored hormone producing increased plasma levels of T4 and T3. T3 feeds back on the pituitary and perhaps the hypothalamus to inhibit the TRH and TSH secretions. Goiter. Goiter. An enlarged thyroid gland is called a goiter. The enlargement may be diffuse, involving most of the gland, or localized, limited to a particular area, as in solitary single nodule. The increased blood flow in diffuse enlargement, for example, in Graves' disease, may give rise of a palpable thrill, vibration felt with the hand, and an audible bruit noise heard through a stethoscope over the gland. C. A letter of referral. Mrs. Davis' doctor has referred her to endocrinologist. Dear doctor, I would be grateful if you would see this 50-year-old woman who has lost 20 kilos in weight in spite of eating more than usual. She describes herself as overactive, and at first she thought the weight loss was due to this. But more recently, she has developed palpitations, diarrhea, and heat intolerance. She has noticed that her hands have a tendency to shake. Her symptoms suggested hyperthyroidism, and this was confirmed by my examination, which revealed an enlarged thyroid, sweaty palms, and a fine tremor of the hands. Overactive, more active than is usual. Palpitations, awareness of rapid of irregular heartbeat, fine tremor, very slight involuntary movements, heat intolerance, inability to cope with high temperatures. Exercises 18.1. Complete a table with words from A, B, and C opposite and related forms for a stress mark in front of the stress syllable in each word. The first one has been done for you. Bear and numb. Inhibit, inhibition. Produce, production. Release, release. Replace, replacement. Secret, secretion. Stimulate, stimulation. Exercise 18.2. Complete the passage from a textbook using the illustration and your own knowledge. Look at the opposite to help you. Pulses of GnRH. Gonadotrophin releasing hormone are released from the hypothalamus and stimulate LH and FSH release from the pituitary. LH stimulates testosterone production from Leydig cells of the testes. Testosterone feeds back on the hypothalamus/pituitary to inhibit GnRH secretion. FSH triggers the Sertoli cells in the seminiferous tubules to produce mature sperm, and the inhibins A and B. Inhibin causes feedback of the pituitary to decrease FSH secretion. Exercise 18.3. Complete the sentences. Look at A and C opposite to help you. A diffuse change affects many parts of an organ or gland. A localized change affects only one part. His diet is deficient in iron. He doesn't get enough iron. SF, T3 and T4 increase the basal metabolic rate. 18.4. Match Mrs. Davis' symptoms with the question that her doctor asked. Look at the opposite to help you. Diarrhea. Are your bowels normal? Eating more. Do you prefer hot weather or cold? Eating more. What is your appetite like? Heat intolerance. Do you prefer hot weather or cold? Overactivity. Are you able to sit and relax? Palpitations. Have you ever felt your heart beating rapidly or irregularly? Weight loss. Is your weight steady? Tremors. Do your hands shake? Chapter 18. No, chapter 19. The eye. A. Parts of the eye. Eyebrow. Eyelid. Eyelashes. Pupil. Iris. B. Examination of the eye. Here is an extract from a textbook description of how to examine the eye. Look at for a squint, strabismus, drooping of the upper lid, ptosis, or oscillation of the eyes, mystemas, inlid lamp. The upper eyelid moves irregularly instead of smoothly when the patient is asked to look down. Next, examine the pupils and know whether they are equal in size, they are regular in outline, evenly circular, they are abnormally dilated, large, or constricted, small. They read normally to light and accommodation, focus on near objects. To test the reaction to accommodation, ask the patient to look into the distance. Hold your finger in front of their nose and ask the patient to look at it. The eyes should come together or converge, and the pupils should constrict as the patient looks at the finger. Check also the cataract opacity of the lens. Opacity of the lens. C. Retinopathy. Hypertensive changes in the retina can be classified from grades 1 to 4. Grade 1, silver wiring. Silver wiring increase in the light reflex of the arteries only. Grade 2. Grade 1 plus arteriovenous nipping in the indentation of veins where they are crossed by arteries. Grade 3. Grade 2 plus plain chain hemorrhages. Hemorrhages and Commonwealth exudates. Grade 4. Grade 3 plus papilledema. Exercises 19.1. Complete the table with words from the opposite and related forms. Verb, noun, adjective. Accommodate, accommodation. Constrict, constriction, constricted. Converge, convergence. Delayed, dilation, dilatation, dilated. Drooping. Oscillate, oscillation. Reaction. 19.12. Match the pictures with the conditions looked at. Be opposite to help you. Dropping of lids. Slits. Dilated pupils. 3. Irregular pupil. 2. Cataract. 5. Squint. 1. Constricted pupils. 4. 19.3. Complete the extract from a textbook. Look at the opposite to help you. Retinoscopy. Examine the retina with a ophthalmoscope, if possible with the pupils dilated to attain the maximum view. Look at for papilledema and for flame shade. Hemorrhages, and arteries exudates. Assess the state of the cotton wool, and note the presence of any narrowing as well as nipping at arteriovenous crossings. Chapter 12. Chapter 20. The gastrointestinal system. Examination of the abdomen. Here is an extract from a textbook description of how to examine the abdomen. Note, if the abdomen is distended by fluid or gas, the presence of fluid can be confirmed by demonstrating shifting Dolmes Perkes of top. First, with the patient lying supine, flat or thereabout. Then ask the patient to lie on one side and Perkes again. If fluid is present, the dual node heart of percussion move. Palpate each region, feeling for tenderness, pain when touched of masses, palpable enlargement of tissue. Now, also any warding of rigidity, shown by contraction of the abdominal muscles. Guarding may be due to the tenderness or anxiety, and can be reduced if the patient is persuaded to relax. Rigidity, however, is constant and is due to peritoneal irritation. Rebound tenderness is pain when the palpitating hand is suddenly removed. It is a sign of peritonitis. Listen for vowel sounds. The feces. There are several words from the feces. Doctors sometimes say, there was blood in the stools. Have you passed blood stools? Patients sometimes say, my motions have been very loose lately. Bowel movement is used to refer to defecation. Have your bowels moved today? Have you had a bowel movement today? Bowel habit is a medical expression meaning the pattern of defecation. Have you noticed any change of bowel habit? How often do you open your bowels? Are you going to the toilet more often than normal? Change in bowel habit could be constipation, hard, infrequent stools, or diarrhea, frequent soft or liquid stools. Normal stools are brown in color and semi-solid or formed. The consistency or degree of hardness and softness can be shown on a scale. Hard, formed, semi-formed, soft or loose, liquid or watery. The color can be vary from black due to altered blood, as in melena, to yellow, gray, or even white. Melena stools are often described as tarry, like tar. The black sticky substance that is used in road making. The stools may be red when fresh blood is present. Blood that can only be detected with a special test is called fecal alcohol blood, FOB. When there is a high fat content, the stools are pale and are sometimes described as clay-colored. Stools that are large in volume are described as bulky. A bad smell is described as foul or offensive. Exercises. Exercise 20.1. Complete the case report. Look at A opposite to help you. Physical examination revealed a thin girl with a slight pallor. She was not obviously dehydrated. The temperature was 38 Celsius. Pulse 100 minutes. Blood pressure 110/80. Examination of the rest of the cardiovascular and respiratory system was normal. The abdomen was not distended. There was generalized tenderness, which was most marked in the right lower quadrant and was associated with boarding rigidity, there was no rebound. Tenderness and no masses were felt. Bowel sounds very reduced. 20.2. Match the description of the stools with the conditions most likely to cause them. Using your medical knowledge, look at B opposite to help you. Type of stools, loose bloody. Ulcerative colitis, loose pale bulky. Quellet disease, clay-colored. Obstructive jaundice, Latari, gastric ulcer, a small heart, irritable bowel syndrome, clear watery with mucus, color. Match the features to the doctor's questions. Look at B opposite to help you. Blood. Have you passed blood stools? Bowel habit. How often do you open your bowels? Change in bowel habit. Are you going to the toilet more often than normal? Bold. Is the size of the amount of the stool normal? Color. What about the appearance of the stools? Consistency. Are the motions hard or loose? Offensiveness. Do the motions have unusual smell?